As we heard from our last panel, there are very important mission things that we have to do, and that's why we entered healthcare. But is whatever sort of innovation we do, we have to make sure that it fits very neatly within the operational paradigm of health systems. So I can tell you that the last turnaround that I did for a really wonderful health system in Florida for a cancer program, we had a 2-week wait to get into chemotherapy for patients. Patients who have a diagnosis of cancer, we're waiting 2 weeks to get time in the chemotherapy chair. It also turns out that chemotherapy provision is something that adds to margin of the health system. And without bringing in AI, we were unable to figure out how, if you have 80 chairs and you have 50 different chemotherapy regimens, some are 1 hour, some are 5 hours, some are 10 hours, how do you fill those chairs? How do you schedule? How you do it? That really is the brilliance of bringing in AI in partnership with clinicians. There's a problem and there's a potential solution where AI adds value. And so when I was walking at a HIMSS conference or a Vive conference in healthcare, and I happened to come across the booth of Exposin, I came across a solution to a really compelling problem. And a statistic that is really amazing, shocking, and should make us all feel really worried is that we lose 18 people per hour in the United States due to medication errors. And I said, that can't be true until I dug into it more fully. I knew as a clinician, I was an emergency doc, that patients come in and you see them, they're on 5, they're on 10 medications. I know that there was no way to look through all of them and look through the latest research and the like, but I couldn't believe really until I delved into it what the deep nature of this problem is. Billions of dollars literally are spent with avoidable admissions to the hospital, avoidable trips to the emergency department, morbidity, and this tremendous mortality. And the truth is that it really is a financial issue because it takes a pharmacist 1 hour to go through one patient's record. To be able to pull in the records, look at creatinine, look at all the health implications, look at different sources, it takes well over an hour. And mostly what they're doing, as was talked about before, is administrative tasks, right? What's the latest value of this? What's the latest value of that? How does it interact? And we did a study at Exposin where it took claims data from 120 people. It's in publication. I can't give the exact details now, but every single patient over 65 years old, every one of them had something that needed to be adjusted in their medications and was not. So the scale of the problem is immense. Financially, as I advise all companies, again, there has to be a business model associated with this, and it turns out that there are payment opportunities for health systems to be reimbursed for this. It's just too low to be able to spend 1 hour per patient. So beautiful use case for AI, and so that's the little bit of the intro and the reason why I became really interested in being involved in this particular use case. So in the next 24 minutes, we'll have a conversation with the CEO, and then I'd like to open up the floor for some conversation. There's a lot of smart people here. I'd love to hear what your thoughts are, both on this use case and AI in particular. I think it'd be tremendous feedback for Anil. So why don't we start asking you, Anil, for an introduction to yourself, and what led you as a successful tech person to decide this is what you were going to spend your time on?
Yeah, thanks, Mark. And thank you, everyone, for taking time. And also, Ransel, for giving us the opportunity. So I'm the co-founder of Exposin. And my background is engineering. So I'm going to tell from an engineer's perspective. So you see, although you see Dr. Anil Chariadat, I have a PhD in AI-related area. And so when we started looking at this problem, as Mark was mentioning, let me ask you, how many of you are happy or confident about the health system that we have? No, not many of you, right? So this is exactly the reason why we started looking at this problem of, how can we improve this? So, for example, we met this woman, 55-year-old woman from Pennsylvania. She went to the physician for a simple fungal infection, and she got a prescription. And she was also on high cholesterol and migraine medications. And some combination of this and some prior history, like triggered something in her body, which kind of triggered, like, I think some of the medication prevented her body from breaking down the cholesterol medication, and it started building toxic. And in few weeks, there was triggered for muscle breakdown, kidney disorder. She was on a wheelchair back in the hospital. And, this is not just one case. As Mark was pointing out, like there are 1 million cases every year in this country for the last 10 years. See, when somebody like me who looks at this problem, and studies after studies says that 40 to 60% of this can be prevented if there is a comprehensive review. So now, as an engineer, when you look at this and say that, hey, why can't there be a review? All this data is there, AI is there, like, why can't we do it? See, that is the excitement and opportunity. You don't understand how deep the problem is with all the healthcare. So yeah, so that is kind of where, we started. We started looking at this problem and say that there's a big opportunity to make an impact. Let's dive into it without understanding how complicated the healthcare industry is. So that's the start of the journey.
So I think you were generous, Anil, in saying that healthcare is an industry because it implies that we have discipline in what we do. And I say that only partially tongue-in-cheek because I think I'm partially at least responsible for this over the last 30 years. But we really have a system that's very complicated. It's very opaque, very difficult to manage. And the turnaround, for example, that I did at the last Cancer Institute required very much structural changes. So why is this just not another kind of idea that you're going to throw at me as the COO or as an investor? What's different about Exposin?
Yeah, I mean, so I'm from San Francisco. Like in San Francisco, like pretty much every day there are 5 startups in AI, every day. And 95% of the startups are going to fail. And already there are studies which says that, like a lot of the startups are already failing because a lot of the startups are just making some tools and going and applying it everywhere. And as Mark was asking, like, so in our case, we looked at this problem. We did not start with AI. We looked at this problem, as I mentioned, like, hey, there is this opportunity for medication review. Then we also have to understand, is there a business process? Then we dug deeper and we understood that there is something called as a MTM, which stands for a medication therapy management. So it's a plan-sponsored review, and we asked some of the users, which are pharmacists, and the health system, why are you not doing this? A lot of other places are doing this. Then they started explaining to us, like, it is not economically feasible for them to do it. It's like it takes like 60 minutes to do a full review, copying the data of the patient's medication, diagnosis, lab value, progress notes. So it's not economical. Now when you see that, okay, now if you can do this in 15 minutes, so that means they can do 3 of them, and now, you get this $70 per review. Now you're looking at $200 per hour, which is more economical. So yeah, so Mark, we have done that part of, understanding the users. Is there to your point, is there a business process? Is there a margin opportunity for the users, in this case, the health systems, to take advantage of it? Is there a requirement by the payers, the health insurance companies? So in this particular problem, everything is coming together. So this is what excites us, and this is what we think that, okay, this is a real chance of making it a successful impact.
So you came from outside of healthcare in the tech and business world where things run a little bit differently, right?
Yeah.
So what surprised you as you started to look at this problem and try to tackle this problem? What was surprising to you?
Surprising is, like if you look at, so typically when it comes to any kind of data problem, like when you see all this rich data, in this case, you have all the clinical data. So a lot of places where you go and say that, okay, you have all this problem, it can be solved quickly. Like, hey, there is an AI system, connect all the data, and boom, you get the, whatever the process. But in the healthcare, it's not really like that. Even to touch any data, you have to go through a lot of integration. So although the data is so close by, you have this EHR, you have this e-prescription software, but it's never easy. So it's not really an AI problem. There's a lot of, like, also the operation. Like, it's not really as, like, I'm sure like Mark knows a lot about this. It's not just developing an AI and putting out there. It's developing an AI and putting it seamlessly into the operation. So this is what we have been focusing so much. Like, how do you make this reviews so seamless. That means, imagine like you are going for your annual checkup. Can a comprehensive medication review be done along with that, or when you are calling for the refill? So there are a lot of opportunities for the hospitals to do this, but we have to make this AI work with those kind of workflows. So those kind of things.
So can you describe how the process functions now with the pharmacists, where they are in the process, and how this empowers them? I can say from my own history of seeing patients in the emergency department, and I'm sure Man and others, as you look at these medication lists, the idea of figuring out what interacts with what the creatinine is today, it's impossible, right? So describe a little bit where the pharmacist's role is now and what Xbosin can do, because there's some conversation about where does the human fit into the system? What's the Xbosin model?
Yeah, I mean, so this reviews, this called as MTM or comprehensive medication reviews are being done now, but it's not being done at a health system. You might think that, okay, health system have access to the patient's data. It's still not done. It's still done outside CVS, Walgreens, some of the PBMs. So we talked to some of the health systems, and they were explaining to us the whole process. So you look at a dashboard where you have all these patients listed who require a medication review. So now you go to that patient, click on this patient, schedule, okay, now I'm going to talk to this patient next week at certain time. You schedule that, then you go to your EHR software, copy some of their diagnoses, progressive notes, lab values. So essentially a lot of work involves copying, pasting, and then a lot of work involves reading through certain guidelines. You read the guidelines. If you are a patient with having this particular medication, and if you are a stage 3 kidney disease, then you know that. So there's a lot of work involved simply looking at the data, reading data, and just comprehending about the data. Now, if you look at AI, some of the AIs are really good at that part. It can read large amount of text, kind of reason it and summarize it and make it a very summarized note, actually. Now, what we are proposing to our customer is, instead of them using a SharePoint, now we are giving them, you can call it more like an intelligent workspace, or like an intelligent co-pilot that would work with the pharmacist, and all they have to do is, by click of a few buttons, they are able to complete the review, and they are able to validate it. So they can make sure that all the reviews that AI has been offered is correct, and they can upload it to the EHR. So this is, and you can do this instead of 60 minutes, you can do this in 15 minutes. So this is the innovation that we are bringing into the system.
One of the past speakers was speaking about burnout from many of us as clinicians, and much of that burnout being due to administrative tasks. So what this does is brings together these huge sort of disparate streams of data and information from the literature, from the clinical story, from the adverse events, and it creates a smart report, really, right? Yeah, with actionable, these are the 5 actionable items for your patient. Here's the 6 pages of references, because we all know AI can also be very difficult to understand. We often don't know why AI says what it says, and so we have to be able to tee up the pharmacists to get to understand that, and then ultimately the clinicians. So we have just a few minutes left here. I'd love to, our audience, and I don't know if anybody has a microphone, or I'll try to repeat your question. Please, ma'am.
That is helpful. There's even the public perception that healthcare is in the business of keeping people sick. And that tracks on to our research landscape, whereby we have a heck of a lot more data around prescribing and all of the interactions, contraindications that you've been mentioning, than we do for deprescribing and safe supervision. So when it comes to your product, does your efficaciousness change in the deprescriptive direction? And if it does, what are you trying to do to kind of close those gaps?
That's just a very insightful and great question. And I think it gets to one of the main points here, because clinicians now, we start from whatever is the current status and accept sort of those diagnoses and the medications that are prescribed. This gets us to the next level, though not perfectly, which is it gets back to the primary literature and looking back at the source as to what are the indications, what diseases are being treated. And in this 120 patient initial study, there were a number of things being treated for which the patient no longer had the disease, even the disease, even by these standards. So I think that it's an important step in that direction. Is it a final step? I don't think so, but I think it's an important step to it. It's a great question, great point.
I have a follow-up question based on the previous question. Like, as you're thinking about this de-prescriptive direction, I was wondering, do you look at frameworks and standards outside of the US? Like, in the US, it's very drug-focused for obvious reasons, like who's donating to the professional organizations that write the guidelines in the first place. Treating cancer in the US is very different in Japan. Treating IBS in the US and UK is also very different when you look at Japan and many other parts of the world. So I was just wondering if you consider that as you guide the patient and the practitioner, something more holistic.
Yeah, it's really a very, very important question is, what's the standard from which this is all judged, right? And so the standard now is pretty narrow. It's based on clinician experience and the medical record. And this is a step in the direction, I think an important step, to bringing in a much more robust set of standards, which are then listed for the clinicians to determine in our context what we're going to do. So the beauty of this is it allows input from multiple different sources, including really the world's literature. And is it perfect? No. Again, is it a step towards broadening by orders of magnitude the data from which decisions are made? Yes.
Thank you. So to follow up on these two questions, you mentioned the importance of teeing up the pharmacist to evaluate what AI has gathered in terms of data. What does that actually mean?
Yeah. So as the process that is involved, so typically in a hospital systems, there are interns and PharmDs. So PharmD is the person who would sign off. The intern is the one who's doing the 60-minute of task. Essentially, what the teeing up means is teeing up everything for a PharmD. So like means you go to the patient's records, capture the records, the relevant records like medications, the diagnosis, the lab values, and essentially take that and copy it somewhere, and then go through his guidelines. As we were asking, like there are some guidelines. For example, some of the hospitals use publications like UpToDate or Medispan. They go through those kind of documents, and they it depends on the system. Some systems use some other guidelines, and so they pretty much go through the guidelines, identify certain interventions. If there are interventions required, identify all those things. And they also require to call the patient to make sure that they have not missed it. There's a 15-minute call required as part of this review process. So after you do everything, then the PharmD comes and evaluates everything and make sure that, okay, everything is proper. Then they are able to sign off. And in this process, there's also a claim submission. You have completed the reviews. You have to generate two types of report. One report is patient education, like you are telling patient, you're taking this medication this way, this is the proper way to do it. And then the second report is the action plan. So you produce these two reports, and it doesn't end there. Then you have to get these reports to physician, to the prescriber, so that they can act on it, right? So then, again, the process is very rudimentary. They pretty much copy and paste this document onto the EHR. So what we are trying to do is, just not the AI, we are trying to make this pipeline much more, efficient. So that, it's not about just doing a review. it's making the impact on the patient, until unless the prescriber sees that. So when the prescriber is sitting, the patient is sitting in front of the prescriber, if they can go through a medication chart, if you put your mouse on the medication chart, immediately you see that, okay, a pharmacist has recommended change in the dosage, they can immediately act. So right now, this is not happening. So this is where, it's just not the AI, just making that whole operation very efficient.
If I told you that most of our health systems use fax machines still, would this surprise people? So it surprises the people that are not in healthcare, but those of us in healthcare, I'll leave you with that thought. So thank you guys for engaging. Appreciate it.
Thank you.